Well, in anticipation of FDA approval, the White House unveiled its plans to roll out COVID-19 vaccinations for children between the ages of 5 and 11. Meanwhile, a deal on President Biden's social spending bill could be on the horizon. The president met with Democrats yesterday. They are trying to hammer out an agreement on a reduced price tag for the proposal. The new target is somewhere between $1.9 and $2.2 trillion. The White House wants to broker a truce between feuding progressive and moderate Democrats and get the president's bill passed. So let's bring in Nancy Cordes to talk about this. She's joining us from the White House. Nancy, it does sound like Democrats are finally making some progress on a compromise bill, but it's going to mean some big cuts. What are you learning?
Yeah, and it's going to have to mean some big cuts, Vlad, because after all, they're trying to get down from about $3.5 trillion to $2 trillion. So nearly slashing this bill in half. And we're finally learning some details about what is going to have to go. Some big priorities. First and foremost, free college, free community college for basically all Americans. That was in the original plan. It would have cost around $100 billion. And that is something, although it was near and dear to many progressives' hearts, something that they appear to be willing to part with. The president has said in the past, anything that doesn't make it into this bill, perhaps they can try again. This isn't one strike and you're out. Other things that they are looking at: paid family leave. You've heard Democrats, you've heard the president talk about this time and time again, the fact that they believe that that people should be guaranteed to be able to not just get time off, but to get paid for that time off, for the birth of a child, for caring for a sick loved one. And so the original proposal had been 12 or 16 weeks of paid family leave. That could go down to as little as 4 weeks in the compromise bill. Some of the things that are likely to remain in the bill that will most likely be safe: child care assistance for low-income individuals, universal pre-K, something that's very important to a lot of Democrats, and potentially an expansion of Medicare to include dental and vision coverage. All of this is still being hashed out, but it is an important signal of some progress. The fact that we are now finally hearing from Democrats about more details about what will stay in the bill and what is likely to go.
Do you know how they're determining, which things may be most likely on the chopping block? Are they just looking for kind of like the things with the biggest price tag, or the things they could pull out of there without having to face too much political fallout? Like, how are they kind of coming to these decisions?
There have been a series of meetings, Anne-Marie, between the president, among progressives, moderates, about the things that are just vital to them. What is the most important to the largest group of Democrats? Universal pre-K, for example, and child care. That's something that not just progressive Democrats have said is really important to them, but moderates and even the holdouts like Joe Manchin are on record as saying, yeah, obviously there are a lot of people who can't get back to work if they can't afford to secure quality child care for their little ones. And so that is something that has widespread support. That's going to stay in the bill. And then there are other measures that have less support. For example, Joe Manchin has been somewhat skeptical of this child tax credit, and he has suggested that perhaps you should have to show proof that you are working in order to get that credit. And so that is a measure that we could see reduced to maybe just one more year of a child tax credit instead of several years, the way Democrats had initially proposed. Because after all, at the end of the day, you've got all the Democrats in the House and Senate basically negotiating with two, Joe Manchin and Kyrsten Sinema, to try to get them on board. And so what they want carries a lot of weight.
All right, let's talk, Nancy, about the plan to vaccinate kids ages 5 to 11, as the FDA authorization for shots for that age group could come up in just the next couple of days. What will the rollout look like?
So the rollout is going to look a little different than the rollout looked like for adults. If you remember back to last year, it was really tiered. Certain high-risk individuals, people who worked in higher-risk jobs, or people who had pre-existing conditions, they were eligible first, and then you went down the line because there wasn't enough vaccine available for everyone all at once. This time around, the White House is announcing they do have enough Pfizer vaccine on hand to enable all children between the ages of 5 and 11 to get vaccinated right away. And beyond that, they're going to be sending that vaccine to locations that are obviously a little different than the locations that they sent adult vaccines to, because kids are not just little adults. They, they get vaccinated at their pediatrician's office, for instance. And so the White House was announcing this morning that they're going to send doses to more than 25,000 pediatricians' offices around the country, more than 100 children's hospitals around the country, and they're going to establish, they say, vaccine sites at community centers and schools, obviously the places where children congregate. Beyond that, they know that there are still a lot of parents who have expressed concern, reluctance to get their children vaccinated. And so the White House announced this morning that the Department of Health and Human Services is also going to be investing in a big public education campaign to address some of the fears and concerns that parents have to make sure that children can get vaccinated across the board as quickly as possible.
My daughter thinks she's a little adult, but that's a whole other ball of wax. Before I let you go, Nancy, we got to ask you about the House committee investigating the deadly January 6th riot, voted in favor of the former Trump aide Steve Bannon being charged with contempt of Congress. Now it has to move over to the full House for a vote. Have we gotten any reaction at all from the White House?
No reaction from the White House on this one. We asked them this morning, but they are already on record on this issue because they sent a letter the other day to the committee and to lawyers for Steve Bannon, basically saying that the notion that Steve Bannon is somehow covered by executive privilege is inaccurate because, after all, he left the White House back in 2017, and the time frame that's covered by this congressional request is years later. It has to do with January 6, 2021, about 4 years after he left the White House. So what the White House is arguing in this letter is that executive privilege is not justified when it comes to an employee who left the White House, who then later may have had communications with the president at the time. They say that the public interest in learning not just about the events leading up to January 6th, but also efforts to pressure the Department of Justice into claiming that there was widespread election fraud. They believe that Steve Bannon had involvement in both of those efforts, and they say that anything that he communicated with the president is fair game and should go to this committee.
All right. Nancy Cordes, thank you very much.
You're welcome.